The same.
Now you mentioned miscarriages. What exactly is it, and how do we define, is it only something that happens when you lose a pregnancy during the first 3 months, the first trimester? And what are the reasons? And then does it become a recurrent factor?
All right. First, the definition. When babies won't survive till 28 weeks of pregnancy, before that was a miscarriage, then 24 weeks, 22 weeks. It's the age of viability.
Okay.
So generally 22 weeks, 24 weeks, different definitions, different areas. That any pregnancy loss before that is a miscarriage, right? Even the second trimester ones, right? The recurrent miscarriage is when there's consecutive loss of 3 pregnancies.
Okay.
That's when we define recurrent.
Right.
Most people are pretty traumatized by their second loss, right?
Definitely.
They want answers.
Yes.
One answer that we didn't have previously, which we have now, when the pregnancy is lost, the products of conception, what comes out, even whether it's a DNC or something, we didn't have tests for that. Now we do.
Okay.
We can send it for DNA testing, right?
Okay, right.
So initially that used to only be done in research settings, but now we can offer it in clinical settings. It's still very expensive, but if someone's that traumatized and they want answers, then we can offer it.
And they have the resources. Yeah.
Then we plan for it. That if they get pregnant the 3rd or the 4th time and they lose again, then we can offer that test. At least now we have an avenue for more answers.
Investigation.
Which we didn't have before.
Right.
There are a ton of other tests, and that's again a whole other show.
Right. Okay. Okay.
But we are not able to have all the answers. Unfortunately, it's not that the issues may not be there. Medical science has not yet reached that point.
Right. Okay. So if a woman has had a miscarriage in her first pregnancy and she gets pregnant again, what should she be doing? Should she be altering anything? Should she be more careful? What is the sort of
the commonest reason for one, or let's say the first miscarriage, is a genetic issue.
Okay.
If the husband and wife are not cousins, it most likely will not happen again.
Okay.
Right?
Okay.
So my advice generally is just treat the second pregnancy as a normal, regular pregnancy. Don't be over cautious. Don't be over vigilant, right? Because if that was the reason, which is like in 1/3 of the pregnancies at least, that's the reason.
That's a high statistic, yeah.
That is high.
Yeah.
So that means that there's just 30% possibility that it can happen again.
Right.
Which is not as much, right? They need to just treat it as a normal pregnancy.
Okay.
Visit their doctor normally. Yes, if it happens again the second time, then before the 3rd pregnancy, have a plan.
Okay.
Not necessarily all the investigations, because that started after a 3rd loss.
Okay.
But you can have a plan with your doctor for the 3rd time. But don't freak out the second time around. There's not a huge...
Don't get too anxious about it.
No.
Don't sort of like, get obsessed with it.
Yes, if there's one miscarriage, I tell my patients to, in fact, offer a prayer of thanks, because there's a great possibility that was an abnormality, and Allah has protected them from that, right? So instead of being upset and disturbed, be grateful.
Right, absolutely, okay.